Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. We have an exciting show lined up. We're going to get right to it. Chest pain, typically in the center or left side, may be a sign of heart attack. However, other conditions, such as one known as GERD, may be the cause. Here to discuss is frequent returning guest, Dr. Fahmi Farah, medical expert and board-certified invasive cardiologist based in Texas. Thank you for joining us, Dr. Farah.
Thank you for having me. It's always so much fun to be on this show with you.
Well, first off, can you give us some of the most common symptoms of heart attack?
Some of the most common symptoms that are considered typical would be chest pain, a lot of times crushing chest pain, shortness of breath, and just profuse sweating a lot of times. There are some atypical signs and symptoms that a lot of times women face, those where they don't have chest pain at all. They'll have nausea and indigestion-like symptoms. And vomiting along with shortness of breath.
You know, I'm 44 years old. Going back the past year or two, all of a sudden I would start having the sharp pain in my chest. And I thought, I can't be having a heart attack. I'm too young. The more I looked into it, I heard about this GERD. Well, explain what it is, because once I read about it, I thought, I bet that's what it is.
So GERD stands for gastroesophageal reflux disorder. It is very much a GI thing. It's where your stomach is producing a lot of acid, and that is refluxing up through your esophagus. And it can give you very typical signs and symptoms as heart attack. Most of the people can't differentiate between a heart attack and the fact that it's GERD, because they will have chest pain. Sometimes that chest pain could be pretty intense. People can have shortness of breath and nausea-like symptoms as well. So very typical signs and symptoms as heart symptoms.
And what about something like sweating or jaw pain?
Sometimes people can even have jaw pain from the gastroesophageal reflux disorder, because a lot of the nerves that are connected it's called referred pain, basically. They can have referred pain in that area as well. So even that could be very similar to a heart attack. Typical heart attack symptom is like they will have that referred pain as well. A lot of times people have jaw pain or neck pain. So they can very much overlap in symptoms.
I basically just need to take a Tums or a Prilosec and I'll be fine. Is that what people who think they might be having these symptoms of GERD, I mean, is that really the main treatment, or is there a surgical option?
It's actually not, and that's not what I would advise at all.
Okay.
That'd be kind of self-diagnosing without knowing exactly what's happening. So the key point here, and very important point I'm trying to make, is that the symptoms can overlap so much that at the initial setting, you don't know whether you're having a heart attack or is this GERD. The advice is to seek help. You do need to go to the emergency department and get yourself checked out and get that confirmation that you are not, in fact, having a heart attack. And then we can shift gears and go to treatment for GERD. And when it comes to GERD, it does have specific diagnostics that your doctor needs to run. One of them is endoscopy, which is it's called an EGD, which is an upper endoscopy. It's basically they put a camera in your mouth, they go into your esophagus, and they look at it to see what it looks like. And that's very important to figure out whether it is in fact coming from that area or not.
Now, does GERD also cause ulcers?
Well, it's the other way around, actually. It's not that GERD can cause ulcer. It's the same origin that's causing GERD. So GERD is coming from increased amount of acid being produced in your stomach, and that balance is kind of off from your body. So the amount of acid is higher than what your body can handle, and now it's refluxing upward. So that same acid can also eat away the lining of the stomach, and that is the definition of ulcer. So really the core issue is something else, and that's why it's so important for you to see your doctor, and specifically a GI doctor in this situation, so that they can run the proper tests. And there's a lot of treatment for this. It's a very easily treatable condition.
Say you're home with someone and they think they're having a heart attack. Are there any simple things that can be done, questions or things to look at so you might be able to distinguish?
When it comes to a heart attack, it's a little different from stroke. So usually patients do not lose their coherence, or they don't have any speech issues typically. The one thing that maybe is, as Ethan said earlier, do I just take Tums or some Gas-X kind of medicine? You can, actually. If you have those available, you can try those. And in the setting of a heart attack, your symptoms usually will not get better. And so a lot of times that's what we see in the emergency department. People do delay their care because they initially think they're having some kind of acid reflux like GERD, and they will start self-treating themselves and it just won't go away. The problem with that is that you do lose valuable time trying to mitigate it on your own, because when it comes to heart attack, time is life. So every minute that you're losing, if it is in fact a heart attack, that can cause detrimental damage to your heart that could be irreversible.
As far as GERD goes, I mean, are there things that we could do to mitigate those symptoms?
So there are great medications that are actually preventative. Those are called proton pump inhibitors, PPI. They actually suppress the acid secretion from the stomach, and they suppress that acid, and as a result, they prevent a flare-up from happening. So people who have GERD, that's probably the number one go-to, just because you want to prevent a flare-up from happening so that you can have your lifestyle the way you choose. Of course, eating healthy is always preferred. And then on top of that, there are some medications you can take in the setting of a flare-up. So if you're having those symptoms, what do you do now? Then there are some over-the-counter ones, like you mentioned, Tums and things like that. But there are some other ones that can coat the stomach as well. Those are prescriptions. So there are many, many different options available. So this is, again, very preventable and very treatable. There are some important complications people need to know about of chronic GERD. Chronic GERD, again, is having from acid that's, disrupting that area, like your mucosa, your lining of the stomach and the esophagus. And when that happens for a long time, it can lead to cancer, esophageal cancer. There are various types. So it's not something to ignore.
Well, great information. Thank you so much for being on the program with us, Dr. Fahmi Farah.
Thank you for having me. It's always a pleasure.
Stay tuned. We'll have more after the break. You are watching American Medicine Today.
The loss of coordination in my legs, I'd trip over my feet, end up flat in the concrete. Dr. Bonati to me was God sent. Walk like that in a while. I don't remember how long. I didn't have to make a massive lifestyle change. I noticed today that I could sit and stand up without a cane. I would have to give it excellent and above my expectations.
Visit AskBonati.com. Mindy Harper is a homemaker and mother of 3 living in Ellenton, Florida. Her condition began after an accident that happened when she was just a toddler living in Manhattan.
I pretty much had been hurting most of my life, and we were living in the city. They were building the Cross Bronx Expressway, they call it the CBE, and there was an explosion, and my dad heard it, and he threw me in the building and threw himself on top of me. And after that, I remember hurting. I started taking pain pills. I remember I was on a medication called Norgesic, and I had to learn to swallow pills. I remember Mom used to crush them in a spoon and put them in applesauce, but you couldn't do that with this pill because it didn't taste good. I also got a TV in my bedroom because I missed a lot of school. And I used to stay in bed a lot because I couldn't move my neck.
Mindy lived this way through her childhood and college.
As time went on, the pain became part of me. It became my new normal. It was just me. I learned how to live with it.
She was told by other doctors that she needed to have surgery or she risked paralysis. Finally, just after graduation, Mindy had her first back surgery, from which she spent a year recovering. But 10 years later, her symptoms returned as if she had never had any treatment at all.
I'm having trouble moving. I'm dropping my tools, and I can't work. I'm an optician. So he took me to an urgent care center because I did not want to go to the ER. And the doctor there took an x-ray and he's looking at it. He didn't want to say anything. So I looked at the x-ray and I see that there's a piece of bone growing into my spinal cord and I'm slowly becoming paralyzed again. And this doctor sends me to the #1 neurologist in town, and he tells me He won't talk to me until I do 12 sessions of therapy.
So Mindy reluctantly began her recommended physical therapy.
By the 8th or 9th session, I can't move again. I am so sore. I'm worse off than I was before. I now have neuropathy in my hands and feet. If I go into the grocery store, I come out and I feel like I have frostbite in my hands and feet. So I can't go into stores anymore. So I stopped it and I'm back in bed, and Dr. King gave me a call. So he started asking me, how am I? And I kind of let him know. I didn't use any 4-letter words though. So I went online myself.
After taking matters into her own hands, Mindy found the Bonati Spine Institute located in Hudson, Florida. She called the facility to get more details about her options.
Dr. Bonati actually called me back. It was wonderful that you actually had a physician calling you back that actually knew what he was talking about.
Feeling confident that she could be treated with the patented Bonati Spine Procedures, Mindy scheduled her surgery. And the enduring pain she felt for decades had finally disappeared.
I remember sitting up. I don't hurt at all. Since the surgery, I can pick up groceries by myself. I can pick up the dog. I have more strength in my arms. Good for cleaning, pushing a vacuum. When I drive, I can turn my head much easier than before the surgery. Oh, the family's really happy about that. But I'm still the worst driver.
And those pain medications that she got used to taking every day, no longer part of her daily routine.
I don't have to take pain medication anymore. To me, that is fantastic. I just feel normal. There was no recovery time with me. I can't speak highly enough about the Bonati Spine Institute.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.
Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, and we see a lot of individuals that come to us with cervical and lumbar spine pain. What is it we need to understand about those issues?
The population of pain on the cervical spine and the lumbar spine is enormous. It's around 1/3 of the human race affected by this problem. We need to analyze why this happened. And usually the pain is progressive. People who has neck pain, for example, or back pain, initially have some discomfort. And then they ignore those ones because it goes away. And then they live many years with that. And then they continue, suddenly the pain becomes a little more erratic, more intense. And this time they use some medication like Tylenol or aspirin or something like that. So years go by, and then this time the pain becomes intense, and the patient starts to use braces. And then later on, suddenly one day, the pain is extremely intense. It's so intense that the patient is being thrown in bed for 2, 3, 4 days, and then gets better. At that time, the patient starts to realize that really has a problem on his back. Because before was something that appeared, disappeared, and now this one, it was pretty bad. We don't really know what the cause of that, because it's not unique. This is not a type of a disease that we can take a look at this one. It's like a syndrome, affects different areas. This individual now who has this pain can be associated with degenerative disc. The degenerative disc will give you back pain or neck pain. Now, can be also associated with the spinal stenosis. Spinal stenosis will give you back pain and neck pain. Can be associated with herniated disc. that will also give you neck pain and back pain. So there are different type of situations that they affect the cervical and the lumbar spine that they can create neck and back pain.
So when you say you have neck pain, it's not necessarily only the neck. It can be a pain that radiates into the shoulder, into the arm and the hand, causing weakness as you go to grip. You won't have the strength or weakness. And as far as lumbar, it can actually radiate into the buttocks, the hip, and the knee, and down into the foot. So it's not only that it would just be neck pain or back pain, correct?
What you are doing is you are identifying that the neck pain is not only neck pain. The neck pain can be a cause created, but what that problem can go together is with an irritation of the specific nerve. And then that specific nerve will give you the pains that you are describing. Will go to the arm or will go to the leg.
We're going to continue our discussion on cervical and lumbar spine pain right after this break.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
And when I got up off that table, it was like, like a reborn again when I was able to walk off that table and walk out and go for lunch. I went in there at 10 o'clock, got operated on. At 12 o'clock, I was walking out on my own.
We went to the Bonati Institute, and that was the day, the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail.
Welcome back to American Medicine Today. We're going to continue our discussion with Dr. Bonati about lumbar and cervical spine pain. So you see a lot of patients sometimes that think they need a shoulder replacement or a hip replacement or a knee replacement. And it turns out that it's none of those things. It really relates back to the spine.
When you have a training, and the training, really you have a good training in neurology, and you have a good training in orthopedics, then you can identify, for example, the problem and say, this is really a damage on the muscles and on the bone, or you can divide, this is a nerve problem. That's why always when you have a shoulder pain, you just don't tackle the shoulder and get an MRI of the shoulder and x-rays of the shoulder and then go and decide that you're going to do surgery there, because you may be missing a cervical disc that's creating the pain. So the diagnosis of this is very important. And if you don't do it right, then you're going to be operating things that you shouldn't be operating. I have people that sometimes have surgery on the hip, and then they replace the hip. And then the patient come back to me and say, I still have some pain on my hip. But the pain is coming from the spine. And if they will do the diagnosis before, then they would not replace the hip. That's why the education in the medical schools, they need to be very intense to physiopathology and anatomy, because then you will be able to put together things that usually don't.
So you talk about cervical spine pain, but that can actually trigger headaches. Is that correct?
If you have a problem on the cervical spine, it's not unusual to see people that they have a car accident and they have a whiplash injury. And that whiplash injury, they have a horrible headaches for 7 months. And then suddenly the headache disappears, but still the arm pain and all the other things remain. The problem there is that can be treated in 1 day. If you just go and decompress a little bit and protect the area of the dura, then the headache is gone, right? But the people are not treating in that way.
No, because they're prescribing the medications.
What they do is they do therapy, they do physical therapy, they do pain management, and the real truth, the patient is just with a lot of loss of time, lots of work, lots of family relationship, and all this because constantly are in pain.
And they're also being told by doctors that it's all in their head.
They are going to select the patient who can get the surgery because those patients that they have emotional situation, family problems, economical problems, patients that they have, they're not stable, things like that, those patients, don't touch them. So wait a minute, those are the patients that they are unstable because of the pain. They are unhappy because of the pain. They don't have money because of the pain. So you need to go ahead and focus on those ones.
Well, let's hope they find a better solution than only treating a subsection of all those that are truly needing medical help. Well, that's all the time we have for this episode of American Medicine Today. Make sure you check us out again next week, and you can search us on all your favorite streaming apps. Keyword AMT.
If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.